Hey everybody, it's Professor Vernillo checking in for week 5. This week we are doing unit 3, which is population health nursing strategies. You're going to be responsible for reading in its entirety chapter 9 on political strategies and chapter 10 on community empowerment strategies. You need to do your readings in your ATI community chapter 4. You need to complete the engage community and public health modules. The community programming, planning, implementation, and evaluation. You have a discussion forum that you need to create a thoughtful and well-organized initial post and do a peer response. You have a concept map. You have some quizzes and, of course, your clinical simulation in ATI. So if you go through your book on chapter 9, you're going to be analyzing potential population health nursing roles in policy development, discussing avenues for public policy development, describe 4 aspects of policy development process, and apply that criteria for health policy evaluations. You have some key terms to look at. And this chapter goes over the relationship between public policy and health policy involves courses of action designed to achieve health-related goals. Looking at the World Health Organization, it has direct impact on health in the population. The overall goal of health policy is to promote the highest possible level of health in a population while maintaining costs. And then we have different types of policies. We have substantive policies, which dictate action to be taken. So this is like legislation. Mandating helmet use by bicycle riders would be an example of this type of policy. Procedural policies are those that determine how the action will occur. So in the case of a helmet law, procedural policies would determine how the law would be implemented. In my area, it's 16. Everybody from ages 0 through 16 needs to have a helmet. Policies can also be categorized as allocative or regulatory. And allocative policies distribute goods and services among members of the population. So like Medicare and Medicaid are examples of an allocative policy. They determine who will receive care reimbursed by the different funding sources. We have redistributive policies. For example, taxing the income of some citizens to fund services is considered redistributive. We have regulatory policies that restrict or constrain behavior for, so like nurse practice acts are a regulatory policy. It goes over some legislation. The book reviews your evidence-based practice. There's a guide on a typical legislative process where it starts at the top with Senate and House and moves itself through the subcommittees all the way down to when it's signed into law. In Table 9.1, it goes over the congressional committees with health-related responsibilities. Then you have your Senate committees, your health-related responsibilities, House of Representatives, and health-related responsibilities. Your book goes over regulation and administrative judicial decisions. There's some highlights on the Wisconsin State Health Plan. Goes over different other state health plans, development process, spheres of nursing influence into policy development. And we're highlighting the policy development process. So we're identifying and assessing a problem. We're setting an agenda. We're formulating proposed policy to address the problem that we've already assessed. We bring in the involvement of interest groups, different stakeholders. Then we're doing the policy implementation, and then we are evaluating the effects, benefits, costs, risk, and progress toward problem solution. And then we're doing policy modification as needed. So 9.2 in your table in your book goes over population health nursing roles and activities as it pertains in policy development. So your average citizen is voting, staying informed, speaking out on policy issues, participating in public forums, becoming acquainted with elected officials, joining politically active professional nursing organizations. Then you could be an activist, you're contacting public officials, you're registering members of the public to vote, you're working with political campaigns, writing letters to the editor, writing your senators, inviting legislators to work in different workshops with you, organizing media events. These are the people who are being activists. Then we actually have a politician who's running for public office. They seek appointment to regulatory bodies. And then a researcher who's assuring that the quality, integrity, and objectivity of the data of the policies is being looked at. And the book goes over some political global perspectives, your biological determinants, psychological determinants, environmental determinants, socio-cultural determinants, and then values and ethical considerations. And in table 9.3, there's some elements of an issue analysis where different elements of the issue and the explanation of what they are. So like problem identification and analysis, we're looking at a description of the problem, including information regarding causes and effects. We're looking at the history of the issue, prior attempts at the particular problem resolution, and it works its way down. There's a focus assessment on policy situation and implementation. And then as you go through, it talks about, voting and campaigning, electioneering. Table 9.4 goes over strategies to promote policy adoption. The Patient Protection and Affordable Care Act, which is Public Law 111-148, which is generally known as Obamacare. It was a very sweeping piece of U.S. health-related legislation in the last several years. We culminated with Patient Protection Affordable Act, which was signed March of 2010. And then in spite of political and legal challenges, it's still here. So at the end, there's a chapter recap. There is a case study on influencing housing policy that you should look at. Having stable living situation, affordable living situation is a factor in healthcare. So that'd be something for you to look at. Your reference pages. And then chapter 10 is the community empowerment strategies. So you're identifying levels of community empowerment. We are applying those selected models to the community empowerment. You're going to describe the process, apply criteria, and analyze the role. There's some key terms that you need to look at that you will see again. There's an advocacy then and now. So it goes over how Harriet Tubman epitomized the concept of nurse empowering others. And then there's a self-empowerment of Indian women in the state of Gujarat, India, and how they found themselves living in poverty with no employment security and no coverage under the National Social Security system. So then there's some information on empowerment and powerlessness. Powerlessness being the belief that one's actions cannot determine the achievement of outcomes sought. There's community development. And then there's a little chart at the bottom of the page that goes over community empowerment being like the main piece, and then all the little puzzle pieces that fit in with that. It goes over global perspectives, international capacity building, and the different levels of empowerment. We have some models for community empowerment. They can be conceptualized in a number of different ways. There's various models for viewing community empowerment. Population health nursing as it pertains to community empowerment and what their role is in fostering that empowerment. Population health nurses, other healthcare professionals who are desiring to foster empowerment, organizations in communities and population groups, we need to first foster perceptions of ourselves as partners with the community. And then it goes over assessing community strengths and needs, planning and implementing the empowerment strategies. Goes over different things called like town hall meetings, where we're bringing a group of like-minded people together to learn more so that we can empower other professionals to engage in activities. Table 10.1 goes over the elements of strength and dimensions of a culture as it pertains to community empowerment assessments. So there's an element of strength, like altruism is the extent to which community members are willing to sacrifice personal goals to achieve the greater good or the goals of the group. There's a focused assessment on selecting an issue for community empowerment. Table 10.2 goes over the tasks of group development by stage and the related nursing process component. Remember, we never get away from the nursing process. Remember that whole ADPI: assessment, diagnosis, planning, implementation, and evaluation. Group action requires group decisions, and decisions must be made after careful consideration by group members. To facilitate decision-making, group members should agree on a method by which decisions are going to be made. And there's an evidence-based practice on supporting community empowerment. Make sure you read over that. It goes over citizen government strategies. Table 10.3 is skills required for the stages of involvement in community empowerment and evaluating community empowerment. There's some highlights on the advantages of participatory evaluations. Table 10.4 will go over the domains of community empowerment. So there's community activation, there's the competence and development, the program management and development, and supportive environment development. There's a really good chapter recap, a case study on indigent healthcare. Talks about how as a community health nurse, you're given a referral to visit Mrs. Esparza. She lost her baby during a premature delivery and goes over her neighborhood. This plays a big role into that community windshield survey project that you guys are going to be submitting at the end of the semester. You're arriving at the home, you're discovering it's a 2-bedroom apartment. It's occupied by 3 different couples and 5 children. And it goes over all the different things that you are observing, and you're using all of your senses when you are doing these community surveys. There's some references for you, and that's pretty much chapters 9 and 10. I know they can seem like they're a little bit more of a boring chapters when it comes to community health, but they are a very important chapter because everything that we do as nursing, all the laws that guide us, all come from this political strategies and community empowerment strategies. So that it's kind of the backbone to getting policy changes done in our country. So I will finish uploading all the information that you need for the week. If you have any questions, you know how to reach me.